Good morning. Welcome back to Open Med School. Today we are discussing few MCQs related to cranial nerve 1, 2 and 5. So let us go to the first question. A 65-year-old presents with loss of smell following a fall from a height. He has no nasal congestion, upper respiratory symptoms. What is the most likely cause of his anosmia? The correct answer is head trauma affecting the cribriform plate. So here you can see the olfactory bulb, and this is the olfactory nerve which is passing through the cribriform plate, then goes to the olfactory cortex and the temporal lobe, mainly the angus. So a violent shaking can produce rupture of these fibers and can lead on to. Remember some other common abnormalities that you can get. Suppose there's an irritation in the angus, you can get as a part of temporal lobe epilepsy, otherwise called the uncinate seizures. Patient may experience bad smell, acrid smell, as if a bone is being burned. A tumor arising from the frontal lobe can compress the olfactory bulb and can produce unilateral anosmia. Then disorders of the nose like rhinitis, common cold can lead on to. Other important neurological conditions that can present is Alzheimer's disease. Olfactory impairment is common and is progressive and usually presents with memory loss. In Parkinson's disease also you can get impaired smell. Nasal polyp can cause anosmia but is associated with nasal obstruction which is absent in this patient. Common cold is one of the most important condition for a common cause. Then viral infections like COVID can lead on to anosmia. Parkinson's disease, there is early anosmia, but often gradual rather than acutely after trauma. So here the most appropriate answer is trauma. Remember, loss of smell usually presents with lack of taste rather than presenting as loss of smell. Sometimes a tumor arising from the frontal lobe can compress on the optic nerve also and can be associated with unilateral optic atrophy due to the compression of the optic nerve and contralateral papillary edema, otherwise called the Foster Kennedy syndrome. Foster Kennedy. Abnormalities in the smell in the form of altered smell is called parosmia. So today we have learned about the anosmia, parosmia, and the olfactory or the angal seizure, or otherwise called uncinate fits. That is the temporal lobe epilepsy presenting as abnormal smell. Testing of smell is important in appropriate conditions like this. Hope it was useful to you. Thank you.